What is maybe the most recent thing that you consider that you've accomplished as a committee?
Last thing we accomplished was the definition of like what is an Oregonian.
Mm,
And I don't remember which definition we picked, but that has gone to the main board and they're going as a straw proposal. And so then it's up to the main board to say like, yeah, we think you're generally on the right track, or no, this is like why are you even doing this? No, stop. And then they kind of give us some guidance and then we come back to like finalize. So that's the last thing we did. And now we're in several separate committees to figure out what how to pay people.
mm,
And so I'm on the behavioral health subcommittee to figure out. So you get a big pile of money and you give it to a CCO or like some version, whatever we end up evolving the system into that's going to be kind of like a CCO, probably a different acronym, but we give them a big pile of money. And then it's up to them to figure out like how much of it goes to the hospital and how much to the this and how much to the that. And there are different ways to pay people. Like right now, so what I'm most familiar with as a therapist, fee for service. I see you for an hour, I bill Care Oregon for an hour, and they give me a check. Easy.
yeah,
A lot of stuff's fee for service, but that's not always the best.
yeah,
That's kind of paying people to be. It's really, for me as a therapist, it's in my best financial interest for you to keep coming back, even if you don't need to be, or if I was some sort of, medical provider to like do tests, even if you don't need those tests, because
right,
I get paid for the services.
right.
So fee for service is not always the way to go. Sometimes you want a capitated basis, or maybe you could just like give someone a salary, like I just get a monthly salary. It doesn't matter if I see 20 clients or 100 clients, I get paid the same. And then I just, then it's in my financial best interest to get people well so they don't have to keep coming back to me and I can have more free time. There's different pros and cons to all of this stuff.
And have you landed on a recommendation that you're going to bring forward to the board, specifically maybe for mental behavioral health specifically, or
Still working on that. I
yeah?
think we're going to be talking about that one next time.